Welcome back to Juv'ae Podcast. This is episode 5. We're here with a special guest, founder and owner of Youthful Cosmetic Clinic, Lisa Zipp. Did I say that right?
Yeah, that's perfect.
Nailed it. So, in the various episodes, we've just talked about different stages of everyone's journey. And also, big topics. So, we brought you in today because you're one of Juv'ae's success stories. Relatively early in your journey, I'd say, in the big scheme of things. So do you want to tell us a bit about yourself and your clinic?
Yes. So coming up this November will be 4 years. I started in 2020, right before...
It's been 4 years already.
Yeah, 4 years this November. Yeah. Prior to that, I was in ICU nursing. And I had 2 young children and just wanted to have a better work-life balance. So I was actually also on my own sort of anti-aging journey. I turned 36 and just started to feel quite, old, and had never really invested in my skin or anything like that. And someone actually told me you need to start Botox, and I was really sort of thrown by that. And I didn't know much about Botox. I associated it with, the Hollywood fillers and cheeks and things like that. And I thought, no way, that's not me. And I was quite intrigued. I started researching Botox and I was like, oh gosh, like it's really not what they say it is. Yeah. And that's what got me sort of researching, should I do a post-grad in, like in beauty or in cosmetic injectables, and started to inquire, and that's how I stumbled across Juv'ae. I had an interview with Nicole, and I got down to Sydney just before the borders shut with COVID, and journey just sort of went from there. I just started off renting a room. I was still working in ICU. I was also working in radiology, and as my clientele picked up, I sort of decided to bite the bullet and bought my clinic in 2021.
So just about the next year, 12 months after,
And I was still working in ICU, and as my clientele grew, that's when I decided to do it full time, and it's just continued to grow from there.
Yeah, so it's been 4 years, but you've actually gone through all those stages fairly quickly. So I think it'd be good to sort of pick your brain on the steps along the way, just for some of the newer budding injectors. So run me through sort of that journey. So you first started off with Juv'ae, did the boot camp, and then sort of where did it go from there?
So did the boot camp, came back. I was only working 1 day a week, and I guess to get myself established, I was very fortunate in Hervey Bay because I am rural remote. I guess you would class Hervey Bay as, and I didn't have a lot of competition. There is more competition coming to Hervey Bay. I don't see it as competition though. I think there's plenty of work for everyone. Once I realised I was doing okay, I guess, once my clientele picked up, I decided I've either got to go all in or just still, drip feed the work. And I bit the bullet. I knew I had the backing from Juv'ae as well. I knew I had the business resources and the marketing resources and the support through Juv'ae, and fortunately a very supportive partner as well. Supportive nurses around me in the Juv'ae family. And I don't know, I guess I saw that they were doing it. And I was like, I just had that drive, I guess, at that time. I still do have that drive. Sometimes I look back and I go, gosh, how did I make it? And really, even just being asked to do things like this, I really didn't realise how successful or how quickly. And so
when you're first starting out, I guess you want to get the adequate training, because at the end of the day, this is going to be your bread and butter, right? And so I think it's really important to find somewhere that'll give you really good training, because that's the foundation of your skills. I think the Juv'ae is great for that. And so from that, I guess once you've got the skill set, how do you maintain that and grow that skill set.
Yeah.
And then so talk us through like how do you sort of keep growing it in terms of skills?
I guess being rural remote, I did struggle a little bit with having to attend trainings, but I made sure I did. And I think that's what you have to do. And I like how Juv'ae have their trainings sort of staggered as well. You know, start with, you know, the basics first and build on that. You have to get good at the basic stuff first. And like, I know that there's treatments out there that I'll never do because I know I won't probably do enough of them in Hervey Bay to be good at it.
Yeah, that's fair enough.
So definitely attending as much as you can. I was very fortunate to have a really great mentor within Juv'ae, Kira, and I was able to, you know, always have her backing, and I could go down into her clinic and shadow her, and if there was something that I wasn't sure about, or even pricing, you know, like, I always had that support. And also the business marketing side of it. I worked a lot with Mel at the beginning, and also Brooke in marketing as well. So training was really important in the beginning. It still is very important. I find I'm not able to get to as many trainings now.
Just because you're so busy.
But I will always be at these sorts of events as well. Like, Juv'ae will always put on a really good.
I think it's really important to continue on the learning path, upgrading your skills, upskilling, that sort of thing. But let's go back to sort of when you just first started opening up your clinic, or maybe even before opening up your clinic. I guess when you're a newbie injector, the first thing the thing that was always weighing in your mind is how do I grow, right? How do I foster that client database? So how did you go about building your database, so your clientele and that sort of thing? Any tips?
I think even if you're not amazing at social media, which I know that's not a strength of
I don't
mine,
think it's,
you have to have a presence. Unfortunately, I knew that if I stopped posting a before and after photo, my bookings would go quiet. So even if it was just me getting on talking about something, people like to, what I've learned is to know you, even if it's not necessarily about work, even on a bit of a personal level. They every now and then I would have my family on there and that sort of thing. So having a social media presence did help me build clientele. I had to put myself out there a little bit as well and push myself to go to networking events, even though I didn't enjoy them. I love them now. But I had to sort of get out of my comfort zone and do those networking events, show up on social media. And also word of mouth worked really, really well. So I think making sure you always had enough time for your patients as well, trying to get to know them on a more personal level.
You've got to gel with them.
I had a lot of my patients will still say to me, they love coming to the clinic. It's a beautiful space, it's a beautiful environment, and they don't feel like they're in a production line. So they've been to places before where you sort of just like in, out. And I just think for the treatment that it is, you have to make sure that they trust you. And you can't sort of get that trust in a 15-minute appointment.
I think so
I've never shortened my appointments, even in the entire time, like the nearly 4 years. I've still kept my appointments all the same time, even though I know that I could get more people in.
Because they're again, they're not paying like small amounts of money.
No.
And so if you're just in and out, it's kind of like, what just happened? It's just so like I've just paid $600 and it's like it's really quick and I didn't even like what just happened. So I feel like just take your time with your patients, get to know them, build that rapport. And once they're comfortable with you, and obviously you try and get good results with continuous training and that sort of thing. But I think that rapport is also a really big part in client retention and also word of mouth. So I think that's a really good point that you raised, that don't just shorten all your appointments just to fit more in, like foster those relationships that you have, because they can go a long way.
Yeah. And even your patients knowing post-care that they can get in touch with you. They can let you know if they've got any issues as well. They feel comfortable with you as well. So really working, I guess, on those relationships. That's what creates word of mouth, and that's what worked really well, especially in a small town for me.
So in those first 12 months, obviously, so you've relied hugely on word of mouth. You've obviously got good enough results to, get that word of mouth to spread as well. So you got good results there. How do you then sort of maintain that growth? What are your sort of next steps to sort of grow from there? Yeah,
I'm in a bit of a tricky spot at the moment because I know that I could grow my business so much more, adding different modalities into the clinic. I've grown with just hiring a beauty therapist last year. So I find my thing is a little bit more about skin now. So, and I think that's obviously the way that the trend is going. And I really like it as well because I find I do, talk a lot of treatments down or I try to avoid treatments. If I've got people coming into the clinic that have never done anything for their skin, I've now got the resource to be able to, put them onto someone, and that's within my business.
I think that's the way that the industry is sort of going, right? We're more focusing on less overfilled. The growing importance of skincare and that sort of thing. So it's important to know the demands of the industry and sort of know, if you have a niche sort of market where you are and that sort of thing.
I don't want to grow so big that I don't enjoy it or it's too much. I still have to remember why I started, and that was to have that balance, and I don't want to never not enjoy my job. So making sure I'm doing the hours that I want to do that work well with my family, and doing the treatments that I also believe in. There's obviously a lot of fads out there, so as much as I would like to grow, I feel like what I've done so far has been working. So I'm just going to continue on that path, and when I feel that it's right to take on new challenges, I will. And
that's I think that's another really big important thing to factor in, is that you should grow at the pace that you're comfortable with. Because if you try and grow too fast, it can get out of hand, it gets more stressful, you've got more things to worry about, and it's quite hard to then dial that back, right? Because you want to sort of grow, but grow within your means and actually still enjoy what you're doing.
I find in this industry, even just coming along to these events, I'm challenged in that way, and that's what I like about the industry. There's new products, there's new techniques. How I learned 3.5 4 years ago to how I'm injecting now is completely different. So I used to be that person that would get a little bit stale in a job. All right, what's the next thing? Let's go. Whereas I don't feel bored in this job, because we're always learning. And so I'm content.
That's good. I feel like some people view content and complacency as similar things, but you want to like I said, you want to grow at a rate that you feel good about the rate that you're growing.
And that you can maintain.
That you can maintain. I think good work-life balance is a big thing. You don't want it to sort of get out of control. Any sort of things that you've learned along the way that you might want to give advice to some of the newer injectors, things to avoid perhaps, things that you should have done earlier perhaps?
I've never been an employer. I've never had an employee until just recently, and I feel I probably could have done that a bit sooner. It has helped sort of establish my business a little bit better, but also it has assisted with the treatments that I'm doing as well. So having a beauty therapist there, I wish I had done that a little bit sooner. In regards to regrets,
not necessarily regrets, but things you learned from.
Things I've learned from. I guess Juv'ae has so many resources. Marketing, business. Mel and Nick will always pick their phone up, regardless of what they're doing, and they'll always call you back. So utilize it. If you've got a question, just ask, because there's always someone there that will help, even with telehealth team. Something you're not sure about, always know that you've got that support, I guess. Don't feel like, I'm going to be bothering them, or I should be able to work this out on my own. Just
because I think in this industry there's sort of two wings, right? Because we've got our own business, so we got to be business minded, and that often sort of gets overlooked because we're doing medical procedures, when health practitioners at the end of the day, and I think some of us focus more of one than the other. It's important to factor in both, because this is our business. It's what gives us income, basically, right? We're not working for another we're not working for another body. We don't have to. We do have to worry about how the business grows as well. So I think that's important to. I don't know if you should weigh more on one or the other, but they're both very important factors in this. And I think some of us sort of lose focus on one or the other sometimes. And that once you sort of go to business and you sort of cut back on the skills and the medical, you kind of lose track of important things like patient safety and that sort of thing, and you sort of brush through that. But it's really important to put sort of good amount of waiting for both, I think.
And I know that I wouldn't have made it on my own. To have everything that we do with Juv'ae, it's incredible. Even if you were to have a complication and not have the backing of a telehealth team, you would be so lost. So I've always felt so comfortable knowing that I've got all those resources to fall back on.
So I think just to wrap it up, the take-home messages I'm getting from you, obviously you're a great success story in the Juv'ae family. Have a good foundation to your start. So, get a good foundation of clinical skills, and always try and, be on top of your upskilling. Put some focus on social media, get out there, put your word out.
If you don't like it,
have a good rapport with your patients, build that relationship, and sort of grow your sort of client base organically in that way as well. And always look to improve, basically. Is that what I'm getting?
And use the support of Juv'ae.
And use the support,
Absolutely.
But thanks for coming by. I appreciate it. Hopefully you can, any last motivational words to the to those that are starting out?
I think back yourself.
Yeah.
Absolutely. What have you got to lose?
Yeah, back yourself. It takes time. Everyone's running their own race. Stick with it, I think. Yeah.
Perfect.
Thanks for that. Cheers.
Thanks, Stephen.
Thanks.